Good evening, my name's Catherine Murray and I'm going to give you an oral presentation about an article I reviewed as part of our literature review assignment. I chose the question, does taste aversion therapy for alcoholism produce behavioural change? And the article I'm going to talk to you about with you today is by Connors, Wolitzer and Derman, Preparing Clients for Alcoholism Treatment, Effects on Treatment Participation and Outcomes. It was published in the Journal of Consulting and Clinical Psychology in 2002. I'm going to give you a little bit of background, talk you through the study, and do a little bit of strengths and weaknesses of this particular study. So by way of background, many of us know about the long history of treatment for alcoholism. One we're probably all familiar with is the classical conditioning paradigm, where alcohol is paired with the intake, taste and environment is paired with a substance that produces nausea in the participant in order to induce an aversion to alcohol. There are also other forms of treatment for alcohol abuse, including individual therapy and group therapy, problem solving and skills training approaches, and this article looks at those kinds of treatments. The aim of this study was to look or evaluate the benefits of true preparatory techniques designed to increase the likelihood of ongoing participation in alcohol abuse treatment programs. They hypothesised that exposure to the pre-treatment preparatory sessions would improve the participation in the treatment programs and therefore improving outcomes. The rationale particularly was to manage or look at the high attrition rates that were noted in alcohol abuse treatment programs, and they felt that few studies had really looked at methods for improving client retention in those programs. So they looked at two strategies that they wanted to evaluate: role induction and motivational enhancement as a way of improving participation, and this fitted in nicely in their current treatment program, supported by empirical data. By methodology, they were 126 alcohol abusers, 87 men and 39 women participating. They were all voluntary. They fulfilled the DSM-3R criteria. They had not had treatment for their alcohol abuse in the last 12 months. They were actively drinking, they were literate and had given consent. The design was a participant was actually randomly assigned to one of three preparatory treatment groups. They were either role induction, motivational interview, non-intervention, or the non-interventional control group. After undergoing their 90-minute intervention, participants were then given appointments for the routine treatment of individual and group sessions. Just to explain, role induction involved a treatment information session where the possible positive or negative effects of treatment was discussed. An outline of expected client behaviour was also mentioned, and a description of what they would expect in the individual and group sessions. The motivational interview was slightly different in that its goal was to motivate and strengthen the commitment of the participant to change. And therefore they spent a lot of time discussing alcohol consumption, relationship problems and other problems that alcohol was contributed to dependence and improving their physical health. So the intention was to assist the client to see the necessity for change. So the results were measured by demographic and substance use data. They used a timeline, follow-back interview, drinker inventory consequences, brief symptom inventory, and discussing the frequency of illicit drug use. These were all measured by self-report of the participants, taken at baseline, post-treatment, 3, 6, and at 12 months. The results of that, there were 79% of the participants completed one therapy session following the preparatory interventions. And this just demonstrates how hard it is to get full participation. 9 participants didn't attend the preparatory session and 8 were completely lost to follow-up. They found that there was no difference in the percentage of attendance between the 3 groups of the sessions. The effect on drinking was evaluated 3 monthly over the next 12 months, with finding no difference between the RA group and the control group. At 3 months, the MI group had more days of abstinence than the other 2 groups, but at 6 months the difference was not really statistically relevant. The conclusions that the researchers came to was that motivational interview group did actually have more abstinent days from alcohol. They increased the treatment session attendance and there were fewer days of post-treatment drug use. They saw a higher rate of overall reported general health than the other two groups, suggesting that the clients may benefit from a motivational interview as a pre-treatment intervention. They also saw some relationship between treatment involvement and treatment outcome. The limitations, of course, was that there was the exclusion of this for participants, including those who were mandated to attend treatment and also those who'd had treatment within the last 12 months. So it makes it difficult to generalise results to all clients. There was also no discussion about the groups of the clients who actually completed all the treatment, and maybe that's a group of folk who were persevered in their treatment that needed to be looked at. The strengths, of course, it demonstrated there was some benefit of pre-treatment preparatory interventions, demonstrated that out of the two strategies, motivational interview provided better results. It also demonstrated that motivational interview readily fitted into the current clinical treatment regime. It also indicated that the effect on outcomes was independent of any other treatment, maybe implying that motivational interview could be used as a single standalone intervention for alcohol use. Weaknesses, it was hard to generalise to a larger group. There was only a weak positive result and there was no discussion on any of the clients who may well have completed the 12-week treatment program. Finally, I think this study demonstrates that there are methods for treatment of alcohol abuse other than aversion therapy that do well. The article was clear and the results and methodology and conclusion readily understood. The limitations are articulated, the weak results noted. However, the authors were very optimistic about motivational interview, and I wanted to include this in the literature review for that reason. Thank you.